Well, a cancer diagnosis is terrifying, and finding the right treatment with the least amount of side effects is, of course, everyone's goal. Our next guest says there is a treatment that can offer just that. Dr. John Kressel of Phoenix Cyberknife Center is here with how they can help. Good to see you, Dr. Kressel.
Good to see you.
So we have a lot of folks watching right now who maybe have never ever heard of Cyberknife.
Yep.
Explain what it is.
So Cyberknife's a name for a type of radiation therapy called stereotactic radiosurgery. It's a fancy name.
Okay.
Bottom line is it's the most precise, most accurate way of delivering radiation therapy, which is one of the three main tools for treating cancer: surgery, chemotherapy, and radiation.
Okay, and we're looking at your office here now. It's a facility where people come in, and oftentimes you have patients, you have one coming up in just a little bit, who tell us about the amazing experience they have. They've never experienced anything like it before. It's like walking in, relaxing on a table, listening to some great music, and then going home.
In some instances, that's absolutely true. Yeah, where they come in, they get their treatment, and they go golfing in the afternoon or go back to work. It all depends on the patient, but when you can deliver a very high dose of radiation in a way that excludes the dose from going to normal healthy tissues, the side effects can sometimes be greatly reduced or in some instances eliminated.
So the old way of radiation versus Cyberknife, what's the difference?
Well, the main difference is accuracy and precision. So in the past, if you were uncertain where the tumor was located, you had to treat a larger area because you had to put a margin around where you were treating to make sure you weren't missing the cancer. But now if you know exactly where it is, and the Cyberknife images the patient throughout treatment and then adjusts the beam, it's the only radiation treatment where the beam actually moves with the patient if there's any detection of movement. So it's always on target, always on track for treating the target. You don't treat the surrounding normal tissues.
Therefore not damaging the surrounding normal tissues, right, in the traditional way.
Yep.
So give me an example of someone, a typical patient who comes in, let's just say a prostate cancer, versus the old way, how many treatments, versus Cyberknife, how many treatments?
So the standard conventional radiation therapy is somewhere around 7, 8, 9 weeks of radiation therapy. And now we can take that basically 9 to 10 weeks of standard radiation therapy, and we deliver it in 5 treatments or 5 days. So it's all done in less than a week.
Unbelievable. And so many patients you have brought on, success stories, they don't have any side effects. Is that always the case?
Not always. There's always a risk with any type of treatment, but the risks have been shown and reported in the literature to be significantly less than other forms of radiation therapy.
So this is in addition to chemotherapy, would you do this, or?
In some disease sites, but for today, we have a patient coming in to share his story about prostate cancer. No chemotherapy, no surgery. Treatment was delivered in 5 days. Didn't really interrupt his life schedule, and he's a cure.
And he's a success story for sure. Covered by insurance, Dr. Kressel.
Yes, this is now in part of standard treatment. It's the most rapidly growing form of radiation therapy for cure for prostate cancer patients, and is accepted and treated by Medicare and standard insurance.
Excellent. Well, I cannot wait for you to meet Mr. Pratt. He's coming up and hear about his experience. Dr. Kressel, thank you. Really good information. And if you have any questions for Phoenix Cyberknife and Radiation Oncology Center, you can email them directly. It's info@pcroc.com. Here's where they're located. It's 4611 East Shea Boulevard. That is in Phoenix. Call this number, 602-441-3845. Of course, learn more, visit phoenixcyberknifecenter.com.